Good evening and welcome. My name is Carolyn Dubé. I'm the Executive Director with Fertility Matters Canada. We're the national patient organization that supports Canadian fertility patients who are struggling to build their families. And I'm thrilled to be here tonight with the generous support of EMD Serono, bringing you this awesome webinar, Staying the Course and Riding the Waves. And of course, waves being this second wave of COVID-19. And I'm here with two fertility experts who are working from Montreal, Dr. Bill Buckett from McGill University Health Centre Fertility Clinic, and Dr. Neil Mahout from the Montreal Fertility Centre. So they are in the heart of one of Canada's hotspots, and they have been managing fertility treatments and patient care, really since the spring. And we're really excited to be listening and learning from them this evening to talk about what this future or the next few months may look like for patients across the country. So Dr. Mahout, Dr. Buckett, thank you so much for being here. Bill, I'd love for you to introduce yourself and tell us a little bit about your clinic.
So I'm the medical director, as you said, of the McGill University Health Centre Fertility Clinic. And we are an academic center, so we do some research, some teaching, hopefully treat couples well. We've been working in various places, first the Royal Victoria Hospital, and now at Place du Puy in downtown Montreal, since really we started in 96, and I first started in 97, and we're still in business, I guess.
An important business. And Neil, I'd love to hear about your clinic.
Sure. So the Montreal Fertility Centre was founded in 2002. It was founded actually by another physician, a colleague of Bill and I's, Marinko Biljan. And in 2007, I returned from the US to take over the clinic because he fell ill. And so I've been running the clinic with my wife, Dr. Hillel, since 2007. And it's grown quite substantially, and we're very, very proud of it. And we're happy to do what we can to help the patients.
Great. Well, I thank both of you for being here tonight and speaking to me and to speak to the patients to kind of answer some of the questions that we've been seeing in our online support groups and in the questions that have come in through our social media. There's a general panic, I think, if I'm being honest, that we sense especially in some parts of this country, that with the second wave coming through and with cities now in a second shutdown mode, that potentially fertility clinics may be affected by that. I'd love to hear what both of you think about the potential of this second wave affecting clinics and a shutdown. Would that happen? Bill, we'll start with you. Sure, yeah.
Yeah, go for it, Bill.
Thanks. Yeah, the question that nobody knows the answer to, of course. So of course we don't know. In Montreal, where we did all shut down, and this was not, this was a mandatory shutdown, thankfully, from the government of all businesses on all non-essential hospital services and health services and things like that. And that lasted for about 3 months. I don't think that going forward, people, unless something was to be very unexpected, I don't think that things will close down in the same way that they did earlier on. I don't know what you think, Neil.
Yeah, I agree with you. I doubt very much that the government wants to close the fertility clinics, at least in Quebec. I suppose if the numbers really, really spiked and went dramatically higher than where they are now, and certainly if the hospitals became inundated and it was sort of a situation where they were calling all physicians, all nurses to help, there might be no choice. But I think that we're getting a lot better at protecting ourselves, and that people are wearing masks and they're social distancing and they're working from home. And I think with all of those types of things, I just don't think that the clinics are going to be asked to shut down, at least not in Quebec.
Yeah, that's great. I feel like, initially when clinics shut down, it was quick, it was swift, nobody knew what they were dealing with, and nobody was prepared with all of the safety measures, not only for personnel, but also in the clinics with the plexiglass and those types of things. So the clinics I know really came together back in the spring, and across the country, clinic owners and physicians came together to say, this is what we need to do. And you worked with the CFAS to make sure that you were set up to be able to maintain business as usual, or COVID usual, without having to potentially shut down, unless, like you said, Neil, there became a very urgent situation for all physicians to help out in other areas.
I mean, I think, Carolyn, I think it was right, having just said that in the spring, that everything was shut down. I think, as you touched on, we didn't know what people were dealing with. We didn't know how it was going to be spread. We didn't know the effect it was going to have on society, and particularly also in Montreal. So I think it was the prudent thing to do to close things down, get everything worked out, and then open up in a more responsible way.
Agreed. So when patients come to clinics now, what can I expect when they sort of walk through the front doors of your clinic? What does it look like now for someone who hasn't ever been to one, or someone who maybe cycled a year or two ago and is now coming back? What does that look like? Is the experience a little bit different?
It's completely different. I mean, I think the first step, obviously, of just getting an appointment, you call and you get a whole list of questions, and those are all COVID safety related questions. And the same thing, used to be that the couples would come in together and there was a nice waiting room and they could sit down in a chair and they could chat. Now we're asking, at least in our clinic, we're asking only the individual who actually is there for a particular reason, a particular procedure, ultrasound, semen analysis, to come themselves, but not with their partner, to wear a mask. And our clinic looks completely different. We've got everyone running around with visors and face masks and hand sanitizer all over, and we installed a whole series of new air filtration devices in the rooms, and so it's just a completely different experience.
Wow.
I mean, I think that what has I think, most of the consultations that we do today, Carolyn, are by the telephone anyway. So if somebody doesn't physically need to be there, then they won't be there. So whereas before, often, and certainly in our clinic, it might be very, very busy and the waiting room is packed and things like this. Now all of the consultations are done by telephone. And exactly as Neil said, when people come, it's only the person who has to be there that comes for their test or ultrasound or egg retrieval or whatever. What other differences do we have? Yes, we have plexiglass things in front of all the receptionists, the security guard, the questions that they get asked as they walk through the door, the little arrow telling them this is the way in, this is the way out, so we only have one flow of people. So, but this is, I mean, it's like this when you go into a store. I mean,
absolutely.
We are rapidly becoming used to this, and of course, everybody in masks and in the waiting room with one chair here and 2 meters away the next chair and stuff like that. So, but this is not unique to what happens in clinics. It's happening throughout society, I think.
Yeah, definitely. Do you find, speaking of, this movement towards telemedicine, has access to your clinics for patients who may not live close, has access changed? Has that been something you're now seeing patients doing an initial assessment just from someone from Northern Quebec who doesn't live in Montreal, those types of things? And do you think that telemedicine may become part of how fertility treatments move once COVID is more under control? Is that the future of fertility?
So, I mean, I think if I could take the first part, people who either come from remote parts of Quebec or from other provinces. I mean, I can't speak for Neil, but we were previously already did telephone consultations with them. You wouldn't want somebody to come 7 hours to go back home again, when we could perhaps do that on the phone. Is it going to be the way that this is done in the future? possibly there's certainly a huge benefits from that. People don't have to waste time taking time off work. Already going through infertility investigations and treatment is a huge burden on most couples, and that could perhaps be lightened somewhat by the move to more telephone or telemedicine consultations. So I think that will come. I think what is so I think that we do miss something by not seeing or not seeing patients. You know, somebody has a difficult diagnosis to deal with or a difficult outcome to deal with. Certainly, personally speaking, I find that much easier with somebody who's physically there, and you can read the couple. You can sort of understand how they feel and react accordingly. And I think, you know, sorry, I'm spending too much talking about this.
No, this is a very important topic.
I think many of our couples sometimes feel that there is less care than there was before, and that's, you know, from the nursing staff, from the medical staff. You know, before, when people were there and you could put an arm on somebody. I think this type of thing is missing, unfortunately, and I don't think we've quite, certainly us anyway, have managed to try and you know, get over that problem.
Agreed.
Yeah, I agree, and you know, I think people's level of stress and anxiety is just through the ceiling, you know, and it's really a challenge to connect. You know, when you're wearing a mask and a visor, even when you're in person, it's very hard because you can't see what their whole face is telling you. And so, you know, I agree with Bill that there are really good parts of telemedicine. And I agree that being in person is in many cases much better, especially when you're dealing with something that's tragic or difficult or emotional. But the way it is being done right now, I think, is it's very hard to connect with patients, and it's very hard to support them in the same way or the way that we would like to support them.
The way that we used to.
Yeah, I would agree. And we do hear that from our patients, you know. I think patients are very understanding. I think we all feel, society feels disconnected, especially as we have been sort of locked down a bit more in the past few weeks or months. And people are craving connection. And this is such a huge part. Family building, especially through AART, is so, it's intimate and it's personal, and you connect with the physicians and your caregivers because they're they are an integral part of you being able to build your family. And so we know that someday that will return. We just don't know when. So actually, a question that we had submitted, I just want to pause for one moment. If you're watching live, please know that you can ask questions for Dr. Bucket and Dr. Mahout in the chat section. So if you have questions, please feel free to put them in in the chat. But someone had submitted a question during registration, and they were curious to know how they can make the most of the relationship with their RE or their fertility specialist if I barely have access to them, especially during this time. So I would assume that means, you know, there's that distance, that physical distance, and that telemedicine piece. Do you have any tips or advice for people to help them strengthen that relationship? That's a hard one.
Yeah, it's hard. I mean, you know, I find that I feel like on a daily basis, I'm running around and working at a level that's commensurate or above the peak of when Quebec had funding. And at the same time, I feel like it's very hard to connect with people. So it's really challenging. And my nurses tell me the same thing as well. You know, that there are times when they feel like, you know, they'd like to be able to hug somebody or you know, talk in their office privately with them and so on, but you just can't. Like, it's all the social distancing and so on. It's really challenging. I don't have a solution for you, but all I wanted to basically say is that we feel the same disconnect.
Yeah, and I think that's important, you know, coming from the experts. You know, sometimes we forget that you're human too, and the reason that you're doing the job that you're doing is because you care. You love it. You want to help people build families, or you wouldn't have been doing this, especially for the length of time that both of you have been doing this type of work. Yeah, Bill, do you have anything else that you think?
I think that's right. I think it's something that, and we touched upon this before, that we're all struggling with. You know, and I don't think the telephone does it, no matter how many times we perhaps speak on the phone. I think when somebody is in treatment and you're seeing somebody, then I think we can try and make more of those interactions than perhaps we were doing before. But I still think there's a lot of care that we need to give prior to making a decision to go ahead with treatment. And I think this is very difficult. Like Neil says, you know, I don't have any kind of magic solutions. I think from a patient perspective, or a couple perspective, I should say, or to try and verbalize those concerns in the telephone consultations, perhaps could open a window to try and explore this a little bit more for each individual person or couple, you know, to try and draw attention to that. But and as I said before, to try and use as much as possible the times when we're physically there. But I think it's a tough thing.
It's a really tough thing. And, you know, if you're watching and you feel like you're missing that connection and you're missing that support and you're not part of an online support group, a peer group. Now, it is different than, of course, connecting with your physicians or your care team. But please know that you can connect with Fertility Matters, and we have online support groups, and feeling connected sometimes just with peers can help fill a bit of that gap when you're feeling so disconnected. In the best of times, but especially during COVID. I'd like to talk a little bit about the effect of COVID on pregnancy, on pregnancy rates, and on the treatment itself. Is there an effect has research shown that COVID can affect a pregnancy? Should people in treatment be concerned about either having been diagnosed with COVID and now going through treatment, having recovered and going through treatment, or being pregnant, especially in those early weeks of a pregnancy, and contracting COVID?
Yeah, I don't think, like, those are all great questions, and Bill and I ask ourselves those questions, and I'm sure patients ask themselves those questions, but I don't think we really know, right? COVID hasn't been around long enough, and there haven't been enough studies properly done, you know, with enough numbers to really answer the question. Yesterday, I was just curious. I went on to Health Canada's website to what they had to say about COVID and pregnancy. And then I went on to the CDC website about what they had to say about COVID and pregnancy, and they were polar opposites. You know, one was saying that there's evidence that, you know, there can be more complications and so on with COVID and pregnancy, and urging caution. That was the US, the CDC. And the Health Canada was sort of saying there's no evidence that it makes a difference. So I really think that we just don't know. I mean, and we'd be much more honest to just say we don't know.
Great. Bill?
I think that's right. I think the we don't know, and that's very clear. I think you know, what little we do know seems to have been reassuring so far. You know, let's talk about COVID in early pregnancy. Does it increase the risk of miscarriage? So far, it doesn't seem to have been shown to do that. Now, does that mean that later on we might discover that it might increase the risk of miscarriage slightly? Perhaps, I don't know. But I think, you know, let's say we have somebody right now who has either got pregnant spontaneously or become pregnant through treatment, and then gets a call because, you know, a family member tested positive for COVID and now they have COVID. Of course, I think in a situation like that, somebody would be very worried, but I think it would be also important to reassure them that what data, limited data, albeit, that we have now should be reassuring. We would not expect somebody to have increased risk of miscarriage. We would not expect somebody to have a high risk of congenital malformations. We would not suggest that somebody do a termination of pregnancy because of risks like that. So I think, you know, we have to balance these things, and maybe that is why we have Health Canada saying one thing and the CDC saying something else as well. You know, I think if somebody is sick and very sick with COVID and there are comorbidities like obesity and diabetes and pregnancy too, then undoubtedly that's going to affect the pregnancy. There's going to be a premature delivery. There may be stay in intensive care before or after delivery. So I think, you know, we can't say that it's going to have no effect, but I think we should be honest about what data we have, and if that is reassuring, share that.
Great. And so that goes to say that we also wouldn't know if COVID has an effect on fertility rate, or if that affects your chances of getting pregnant if you had a positive test.
Correct. And I think, I mean, I don't know if Neil has heard any different or read any different, but certainly even the data that came from some clinics that continue to operate in the United States during in the Northeast United States during that first wave, fairly inconclusive, really.
Yeah. All right, we're going to take a quick pause here. We've got several questions we'd like to ask our attendees. And so I'm going to ask everybody to check out your screen, and you're able to connect. If you're watching this live, please select by touching the screen the answer, and we're going to discuss some of these with you. So we're curious to know if your course of fertility treatment was interrupted or altered due to COVID-19. So your options are: my treatment was canceled, my treatment was not canceled, my treatment was just started, or it's not applicable. It just takes a few seconds for the system to register your answers. And then we'll be able to view those responses in real time. So that's always a fun thing. All right, so 43% of respondents said their treatment was canceled. So that's, you know, that's a significant number of people who are here on this call who have been affected by COVID and had their treatment interrupted. Bill and Neil, I'd love to know, of the patients that you had seen in your clinics or that are now seeing again, if someone had their treatment cycle canceled back in March or April, are you seeing the majority of them come through the clinic now, or did they come through in the summer? Or do you notice that some of them may have backed off? Are your clinics more full? What's going on there?
Well, in terms of the patients, so first of all, yes, many people had treatments cancelled. They were starting treatment, starting stimulation, planning to transfer embryos or whatever, and then we all shut down at the end of March, and so many people's planned treatments were cancelled. Of those people, some people came back when the clinics and services reopened. Some we're seeing now, and some are still not enthusiastic to come back. And I think that depends for many reasons. It depends on where they are in their fertility journey. It may depend on how old they are. It may depend on what options they feel they have. And for example, somebody who is older, who is worried about declining fertility rates, is less inclined, I think, to wait until this kind of thing blows over.
Yeah,
just to echo a little bit of what Bill said, you know, when in Quebec, when the clinics were forced to close at the end of March, essentially what happened was anybody who was doing an IUI cycle or a frozen thaw cycle was just stopped. Wherever they were just stopped. But people who were in the midst of stimulation for an egg retrieval were allowed to proceed to the retrieval, but then it was a freeze-all. So that's kind of how it worked out. You know, one of the things we've talked about recently was just the incredible wave of patients that have come back, you know, over the course of the summer and the fall. So it's many of the clinics have just been inundated with with requests for treatment all simultaneously, it seems.
Yeah.
I mean, I think part of that might be, so there are two things here. There's one, during those months where we were not offering treatment, normally people would have had treatment. So those people have waited, and then the other people come on. So there's naturally, we're doing 3 months, whatever, 6 months in 3 months type thing. And then again, as we had talked before we started, I think there is sometimes an anxiety that if things were to reclose again, and people may feel that this window is quite narrow, and that's why we need to hurry up and have treatment.
I would agree with you, Bill. I think that we're hearing that echoed in our online support groups. There is this webinar is quite timely because we are seeing more and more patients in our online support groups concerned and asking, advice and the opinions of their peers to say, what do you think is going to happen? Our clinic's going to shut down. What does that mean? Should we go now and get our treatment done? Should I book my FET? What, so there is, I find, a heightened anxiety or a little panic, and you can feel it when you're reading those comments and concerns from patients. So I think you hit the nail on the head. I'm sure it's multifactorial, but that for sure is a big piece of it. All right, we've got another poll question. We'll just take a second here. How do you feel about the measures that your clinic has taken in order to protect patients and healthcare workers from COVID-19? So your options are satisfied, neutral, or unsatisfied. And we've asked this question in previous webinars, so it's always interesting to get this data back. And it's really important, I think, for the healthcare professionals to get this data to ensure that their patients feel safe, and whether or not they're communicating their safety measures to patients to keep that communication open. And again, the answers will populate on the screen just as soon as they're tabulated. Satisfied, 69% of our viewers feel satisfied, and then another 30%. So that's great. 0% of people feel unsatisfied. So I think even with the 69% of people feeling satisfied, I think that's a very healthy number. There's some people that were neutral, so they may not really know. They may not have started treatment yet. They may be looking to start at a clinic. Bill and Neil, how do you feel about that number? Do you think is that a good number?
I was also wondering how many would perhaps be unsatisfied and things.
I agree. Yeah.
I think I'm sure there are people who are unsatisfied. Are there things that we could do better or differently? I'm sure there are. So I'm sure there's room for improvement. It's always a question of balance. The more restrictions you make, the more you then reduce access to care. And this is a balance that we're all struggling with.
And everybody's learning. This is, yes, clinics have been open for 6 months or whatever that time period has been, but you're still learning and sort of, like you said, balancing and trying to make decisions to continue care, maintain safety, and and then as your provincial governments put in new restrictions, they can.
Yeah, I mean, I don't even think it's just us, actually. I think you talk about the provincial governments and all jurisdictions are also learning. We're part of the hospital, and advice that we get from the hospital has changed over time. As more evidence becomes clear, policies change and things like this. So I think, yeah, it's evolving.
The other thing I want to add is just that, all of the COVID questions that we ask our patients, our own staff are asked every day. And what we've seen is that there's been a tremendous increase in the number of times where you're short a person here or you're short a person there because they failed the COVID question. You know, somebody had a cough, somebody was with some family member who's got a cough, or somebody's waiting for a COVID test to come back or whatever. So it's not uncommon that I get a text, you know, just before I show up at work saying this person or that person can't come in today for such and such a reason. But, you know, we're all really, really trying hard to be safe and to keep the patients safe and to keep each other safe, right?
Agreed. And I think that that's the consensus, you know, every clinic across the country, not just the Quebec clinics. Everybody is really trying to work together to keep themselves safe in their personal time, to keep themselves safe while they're at work, and to keep not only the patient safe, but the embryo safe and all of that stuff. So I agree. All right, we've got one more poll question. I'll just take a second here. All right, do you feel ready to start treatments at this time? So if you haven't started, or even if you are in a cycle, you know, did you feel ready when you made that choice to move forward, or not? And again, the answer will populate in just a few seconds. A reminder to those of you who are watching live, if you have questions for either Dr. Bill or Dr. Neil, please put them in the chat box and we will get to those questions tonight. Oh, excellent. 94% of viewers do feel ready to start treatment. So I think that is a huge testament to the clinics, to the physicians, to the staff, for your communication, for your efforts to keep everybody safe and healthy. So kudos not only to the both of you and your clinics, but to the rest of the Canadian clinics. I hope that makes you both feel hopeful. And I guess that might be why you've seen this big wave of patients come to the clinic.
Yeah, perhaps, yeah, for sure.
Awesome. So we did have a question, and I'd love to touch on it just a bit. Are fertility treatments protected from shutting down now that they are deemed essential? That one I remember it was talked about a lot in patient circles back in the spring, and that was a challenge that patients figured, and we had discussed that in another session. I'd love to kind of touch on that.
I think Quebec might be different because, as Bill said before, you know, it came right from the health ministry's office that we all just got an email simultaneously saying you're closed, except for, you know, people who are in their stem and those cycles you can finish, but everyone else is not allowed to proceed. And so we had a frantic morning of calling all these people who, you know, were preparing for frozen embryos or IUIs or whatever, and saying, I'm sorry, but we just found out that we can't help you. So I wouldn't say in Quebec I feel protected. I just feel confident that what we're doing will prevent that from being necessary.
Right.
Yes, I mean, I think certainly, I mean, there are a couple of things. So when we closed before, yes, the everything came down from the ministry. I mean, that was done in conjunction with the clinics to make sure it was done in a reasonable and safe way. It wasn't completely done without any input from the clinics and people looking after people with fertility problems. And I remember the debate, probably much more in the United States, about, you know, how fertility treatment was a essential service and therefore had to keep running. I think the way that and now then the question is, does that apply to us and does that protect us? I mean, of course, we think we're an essential service. The reality is, you know, if we look at what happens in the hospital, when things were shut down earlier, elective surgeries were not being done. Now, are elective surgeries an essential service? Well, of course they are. You know, if you can't walk because you need a new hip, then, you know, you still need a new hip for that. And so I think it's all sort of slightly degrees, you know. As we had kind of touched upon before, I don't think there is a move where I would think that we would get advised to stop offering services, even if things were to get a little bit worse. And I think that the aim really across the health service, and that obviously includes us, is to manage this appropriately without having to stop treating people. However, you know, do I think that gives us a carte blanche for us to stand up and say, you know, yeah, we're an essential service like the firemen or the police? No, I don't think so.
Great, thank you for touching on that. It's another question that we do see, or a conversation that we do see patients talking about. So thank you for addressing that. I appreciate your feedback. I'd love now, we're going to switch a little bit, staying in COVID, but we're going to talk about, we've got some questions about the vaccine. And what are your thoughts? Again, we don't know a lot, but what are your thoughts about, or should there be concerns, or what should patients be thinking about when Canada's turn comes to being vaccinated? Are there concerns that the vaccine could affect fertility? Should people wait to have the vaccine until after they've had a transfer? I'd love to open up the conversation around the vaccine in general, and maybe what's being talked about in the fertility community to give that information back to patients.
Yeah, I mean, I'm sure I could just say we don't know, yeah. And that would probably cover most of the answers.
Yeah.
You know, I think always true that when something new comes along, and obviously these vaccines are new, pregnant women or women who are likely to become pregnant are not the people who are tested, right? And so what ends up happening in these trials is that it happens that there are sometimes people who fall pregnant, maybe unintentionally, as part of the study, and then that becomes the group that goes under intense scrutiny to say, okay, well, what happened to them? Were they okay? Was everything fine? So I think we're going to eventually get data, but at the moment there's none. There's absolutely none. I think the bigger question, and it's more of a societal question, is just, you know, there's so many people who are anti-vaccination, and so, you know, how many people across Canada, when the vaccine is ultimately available, how many people will actually get vaccinated, and will that number be enough to provide protection so that we can all take off the masks and take off the visors and say, right, okay, we're okay?
Yeah, I would kind of agree with Neil. I think it's a more, of course, if somebody is planning to get pregnant or in early pregnancy, this is a very important question. But I think the whole role of vaccines is more of a societal one. In other words, the goal is to use that to reduce or even potentially one day perhaps eliminate the disease. And I think, you know, our part in that picture is a very small part over here. Having said that, and again, I don't know enough about the different vaccines that are being trialed at the moment, and I guess we'll have more information and more recommendations once these become available. And amongst those recommendations will be how many months after the vaccine it would be appropriate for somebody to try and get pregnant. And therefore, if that ends up being like the MMR at 3 months, then we might do it at 3 months. But I think we'll be guided very much by what the advice from the manufacturers and the regulators regarding that is.
Great. So, for a takeaway for patients now is we obviously don't know. We don't have the vaccine in Canada right now anyway. But once the vaccine becomes available, that's a discussion they need to have with their fertility specialist to determine the right course of action. What would be the takeaway for patients, or what should they do?
Wait for more information and hope that the vaccine is effective and safe and available soon.
Yes, I mean, I think that's right. I think wait for more information first, and then make an informed choice at the time.
Great, perfect. Thank you so much for answering that. So I've taken up a chunk of this session talking about COVID and shutdowns, and I feel like we've answered a lot of the questions that patients had concerns about coming into tonight's session. Is there any other information or any other things you wanted to touch on specific to COVID before I flip over to some of the medical questions that have come in that we're gonna answer tonight?
There was something else I wanted to say about COVID.
That's okay.
I mean, I'm just, of course, we obviously hope that this will eventually go away. I think, I touched upon before, about the lack of being able to care for patients and couples in the same way. And I think, as this goes on, hopefully we will continue to get better at that.
Mm-hmm.
In the same way that we talked about, how different guidelines about how, social distancing and these other measures that we need to take, and masks and face masks and questions and all of this. I think also as a group, we're learning the best way to manage cases remotely in the context of COVID. And I think, again, speaking from our perspective, I think we're a little bit better at doing this today than we were a few months ago. And I hope that we'll be better still in another 3 months' time.
Absolutely. Neil agrees.
Yeah, I have nothing further to add.
I'm going to go to some of these actually may be COVID related, so I apologize for skipping ahead and saying they wouldn't be COVID related. Some questions that have come in live tonight. These are not questions that came in during the registration. How flexible can clinics be with couples living in remote areas and needing to come to big centers for IVF treatments in terms of reducing the amount of visits for testing and such? Since we would need to self-isolate coming back home because our fertility clinic is outside of our territory, minimizing the number of visits is very important to us. That is a great question. And I'm sure there's lots of people in different parts of the country who are experiencing challenges like that.
So,
yeah, go ahead, Bill.
Okay. I think it's a challenge. I think it's a challenge even pre-COVID times, trying to minimize the number of unnecessary visits, etc. How do we do that? First of all, by trying to be aware of this and trying to take this into account as much as possible. Yes, we have had patients who either have worked in territories or areas where they've had to isolate before going back and isolate upon coming to us. And it has been a challenge. How do we do it better? I'm sure we can do it better than we're doing already, but I think we try to minimize the number of visits, trying to get everything compressed into that short space of time. So when people come down here to Montreal to do this, we can do this in a safe way, and then before allowing them to go back.
Yeah, I mean, I think you try to, as much as you can, reach out to whatever local resources the individual may have or the couple may have, right? So if there are things that can be done locally, ultrasound monitoring, testing, blood work, what have you, you try to do as much of it as you can locally, and only bring them, for the absolutely most essential, most critical elements. And sometimes there's a bit of balancing of quality of care with trying to minimize the inconvenience and all the things that come along with having to physically travel. So sometimes you try to cut back a bit on the monitoring, but you hope that that's not going to adversely affect the outcome. But as I said, it really helps a lot when there are certain things that can be done locally and you can reach out and get that done.
Yeah, that's a good point.
That sometimes depends on the region. Unfortunately, sometimes more remote areas, even access to what is very easy in the city isn't available. And that again
Definitely. Yeah, and I wonder sometimes, are there when you have to travel for medical purposes, potentially, if you do need to, if you can reduce the number of visits, and then when you do reduce the number of visits, checking with your provincial government to make sure you have to isolate when, because you're traveling for medical reasons. So that's something that maybe you could connect with your provincial government for. And I'm sure the clinic would provide the note that says this person or this couple has been here for a medical appointment. Great, thank you for that. My clinic, I have not pre-read these, so I apologize. My clinic is in London and in Toronto. Will partners be able to come to embryo transfers now that they are able to take a COVID test to prove they're COVID negative? In my specific case, this is my 4th embryo transfer, as the past 3 have not worked, and it is hard thinking that I can't have my partner with me this time.
Yeah, I mean, we as we said at the beginning, we've not been allowing partners, and I know it's really, we don't feel good about it, and I know patients don't feel good about it, and it really just comes down to kind of safety trumping all the other things that are important. And you know, for us, it's just that anytime we have somebody in the clinic, there is a potential risk, and if we have a partner, we've just doubled it. And so we've just tried to say, look, it's in the global interest of all our patients for the clinic to remain open and safe. And this is just a safety issue. But, you know, a lot of times we have patients that come for their transfers, for example, they're on FaceTime or they're using, you know, their devices to try to connect in some way. But it's horrible. I mean, it's not the same thing as being there in person. It's just not.
Definitely.
Yeah, I would agree with that. We're the same as Neil. So sadly, partners are not allowed to come for transfers. So there is a lot of FaceTime. Are we like, is FaceTime, is that a commercial thing or whatever? You know,
I think you can.
You know what I mean? You know, by telephone, and people can try and find that way. With respect to that particular question, I mean, it's difficult for us in Quebec to be able to determine what the standard of care and practice is in London and Toronto. And probably the most appropriate way to address that would be to speak to the clinics there and to see, you know, is there likely to be any change in policy in the near future and what that might look like, and try and work around it that way.
Absolutely. Thank you for that. I know it's incredibly challenging when you are, you know, a fertility treatment, you're hopeful, you know, to start having or to grow your family. I mean, it's such a personal, intimate experience and incredibly challenging and emotional without COVID. And to do this without your partner or a support person is incredibly challenging. And, you know, when you're in, you know, if you're in for an embryo transfer, I mean, the nurse can't even hold your hand. You know, that used to be a thing. They could calm you and you know, hold your hand or your knee, and now that's not even an option. So it's just an extra step that makes things so much more isolating for fertility patients who already feel so isolated. And of course, there's nothing that the clinics can do to change that right now, but it is just an added challenge, not only for the patients and of course for the physicians and the nursing staff and the embryologists. You know, if someone in your clinic gets sick, if you're the reproductive endocrinologist, the one and only, and you get COVID, I mean, that is a very challenging situation for the clinic and for everybody else who's cycling. So we understand that minimizing the risk to ensure that your staffing stays the same. I mean, an embryologist, they are not, you know, on every street corner for you to pick up to substitute in when someone isn't available. So we can appreciate that that's a huge risk for your clinics. Thank you for that. One more question that's been submitted tonight. Are ESEC clinics seeing patients during cycle monitoring? My current clinic is not, but the clinic I'm looking to switch to, those REs do. So that sounds like it might be a very clinic specific.
Sorry, I'm sure I understood the question properly. You mean the
physician?
The physician.
Coming in during cycle monitoring, so maybe just maybe it's just the nurse doing the monitoring of the.
I think it's going to be very clinic specific. I mean, in our office, I and my spouse do all the ultrasounds. We're the two physicians, and we do all the scans. But it's going to depend on the clinic, obviously.
I mean, I think that's the same with us too. It's the physicians that do the scans. So, I mean, of course, we're a bigger team than Neil's clinic, but we're all there doing them every day. So.
So very clinic specific.
So I feel a bit bad. I can't really answer. Certainly in Quebec, I think the standard of care would be that the physicians involved in the care of the couple or patient are the ones doing the monitoring.
Great, thank you. So that's a tough one. So if that's if you've asked that question, really that's clinics. I'm sorry, we don't have a better answer, but it is potentially provincially based or the standard of care within your province or specific to that clinic. And I would discuss that with them and see if maybe that is an option. Okay, another question that's come in. This is for either of you. I'd love to know whether it's typical practice, not during COVID, to meet in person to discuss a loss, or for example, after a failed FET, to establish and maintain that human connection with your patients. If so, how are these kinds of meetings being managed now via telemedicine?
So prior, so let's say somebody had unfortunately had a failed treatment cycle, then we would have an appointment to discuss that with them in person, pre-COVID this is, and make a plan about what to do. Now we do this by telephone. You know, as we touched upon before, it's more difficult by the phone. We can't, the connection is not as deep, I think, as it is when you do this in person. But certainly we would try to speak with people after something like a failed transfer and devastating.
Yeah, definitely.
Yeah, I would echo what Bill said. I mean, in the past, what we would have is when we conveyed the news that the cycle was not successful, the question would be, okay, you know, would you like to come in for a visit with the doctor? Would you like to just start another cycle because perhaps you have other embryos? You know, it depends on the context, of course. But it would always be that question of, you know, how would you like to proceed next? And at least in our office, just because we're small and because it's personal anyway, when they come for the ultrasound, they're going to get that consult at that time anyway. It may not be the same length of time that you might have in a sit down in the office, but you're still going to have some conversation about, you know, what can you do differently? What might be missing? What can we add? You know, that type of discussion.
Great, that's really good. That's helpful. Thank you. We've got another question that's come in. Would you recommend patients work from home until their embryo transfer is done or until they're in their second trimester? As well, what happens if after the embryo transfer a patient develops COVID-19? What would happen to the multiple ultrasounds and tests for that? So what would happen for that typical follow-up after a successful transfer? So why don't we touch on the first piece? Do you recommend patients consider working from home or speak to their employers prior to a transfer? Let's talk about that part first.
Do you want to start?
Yeah, I mean, I think in Quebec that's already kind of happened. Like, I mean, any employer who has the ability to allow you know, their staff to work from home is almost certainly already doing that. And yeah, I mean, we routinely have people who ask, you know, after an embryo transfer, if they can either be given a note to alter their risk factors in the interim while they're waiting for the result, or to be off work completely for that period of time. Yeah, I mean, that's pretty standard, I would say, that there's some conversation about that. But most, you know, not everybody obviously, but there are quite a few patients who we have at least who are already working from home and being super cautious.
Yeah, I mean, I would echo that. I think, you know, not just after the embryo transfer, if anybody could be working from home, I think that would be safer for them and and their family and the community generally. So anything that would reduce unnecessary social interaction would be helpful, irrespective of where that is in the treatment cycle. Just as Neil said, we would offer people to either have work restrictions or be off work from the embryo transfer to the pregnancy test anyway. So we would have that discussion and would be more than happy to try and support that in that sense.
Great. So for patients who are watching, if they are interested, if they are working and are able, if they're not working from home and are able to work from home potentially, do you recommend they speak to their employer about that option and their fertility specialist potentially to get a note to say it is recommended? What would they do in that case? Because some provinces, that isn't the case. I know people are recommended from home, but not all provinces are sort of, I know Quebec is very much encouraging people to work from home.
So I think there is a provincial thing here. I think there are set criteria, certainly in Quebec, where this can, it's very kind of structured about who should be working where and things like that. So outside of Quebec, I'm not sure what the best way to do this would.
Yeah, maybe having that discussion with your fertility expert, asking what their advice would be for your specific situation, and then having
sure everybody would be wanting to help whoever to try their individual risk, that's for sure.
Absolutely. We're getting closer to the end of our session. We've just got about 10 minutes left. I'm going to pop on. We've got a couple of more polling questions that we'd like to collect some data on. So those are going to pop onto to your screen. Has your clinic helped you access social supports for coping with delayed treatments due to COVID-19? Yes or no? So as Fertility Matters is always looking for ways to help patients get the information they need to make informed decisions about their reproductive health. How are you feeling about how your clinic has been communicating with you, or how easily you're able to access the information you need for those social supports, online support groups, connecting to patient groups that can help you manage, access to reproductive counselors, that type of thing. Again, it will just take a moment to pop on the screen. This is one of my favorite questions of the night. All right, so we've got, okay, so this is really interesting. 82% of respondents feel that no, their clinic has not helped them access social supports in dealing with their treatments or their delayed treatments because of COVID. Bill and Neil, does that surprise you? Do you?
So when you asked the question, I thought, well, this is obviously one area that certainly we need to improve, and something that we are learning. Thank you, Carolyn, to try and help patients negotiate this. So no, we've been really terrible, and I think we need to look at this and try and make a way to help patients access that. That's for sure.
Absolutely.
I agree. I mean, I don't think we do a very good job at this. I wasn't surprised at the polling number. I actually thought it might even be worse than what it was. But you know, I think this is really something where you can help us. I mean,
absolutely
help us get better at this, because we're clearly not very good at it.
And you know, as an organization, our goal is to provide support to patients, and by connecting with clinics, we can help and we can work together. So this is not specific to Quebec or Montreal fertility clinics, so know that we have an array of patients who have joined us from across the country. And in the other sessions that we've had, in 2 other sessions, very similar numbers have come back. So patients have been feeling that way, and that's why Fertility Matters has been doing webinars like this, and trying to connect with patients and make sure people know that we have online support groups so that they can connect, get information, and if they're feeling frustrated, as more people are these days, we can help guide them So we want to help support you, the medical professionals, in having patients who feel more educated and supported. So thank you for that. All right, next question. Do you feel you can easily find or obtain the information you're seeking from your clinic? So we asked this question not only for COVID-related information, but also just in general about your personal data or information you need about cycling, or even information about what clinic and why that would be a clinic that you would choose, and what makes that clinic stand out to you if you were in the if you had the ability to choose, if you're in one of the bigger cities. So we're just looking at communication and access to that information for people to find. It'll just be a second. I want to thank everybody for being here tonight. It's been a really amazing discussion, and I've learned some more things tonight myself. So thank you to Bill and Neil for being here and sharing your expertise and your opinions and your experience. Do you feel that you can easily find or access the information you're seeking from your clinic? Yes, 27%, 55% said sometimes, and 18% said no. So I think these numbers aren't terrible. You know, 3/4 of the population feels that they're able to get the information they need, at least sometimes. So, so that's something positive. The nice thing is that we know more and more that patients are going online. The research is showing that patients are finding their information. They're going directly to social media. This, you know, these millennials really that are in this reproductive age, they're getting their information from influencers on social media streams. And when we're finding that a lot of clinics haven't caught up to or have made themselves accessible enough to deliver the information, because patients are getting information, according to the research, that might not be as accurate as it would be or should be if it was delivered by a fertility expert. So it's a huge area of growth for fertility experts to get involved. Of course, you know, there's also the time that goes into doing those types of things, and right now everybody's resources are strapped. But I'm always interested in that piece, because again, that's where Fertility Matters can help bridge some of those gaps.
But actually, ironically, Carolyn, I think in some way COVID may have helped this, and certainly I think it has led to many fertility centers post more of their stuff through the website or online and things like that. And so I think we're terribly slow at doing this, but we're doing it better now than we would before. And I think that if there is going to be some positives to take away from this whole pandemic, I think this will be one of them.
Absolutely. Yeah.
Yeah, I think websites are more and more important, and I think that the ability for patients, if they have a question, to know who to ask, and that the answer that they're getting back from the clinic, whether it's from the nurse, the physician, it's very important that those questions are answered promptly and correctly, because you're absolutely right that we see on a daily basis a lot of misinformation.
Mm-hmm.
You know, a lot of patients will come in and they're absolutely well-intentioned, well-meaning, and they'll say, look, I was on the internet last night and I read that ... And you know, sometimes what they then say is absolutely correct, but many times it's not. And it's that interplay between factual information, informative information, things that are really going to be helpful in guiding somebody's care, versus all the noise. And sometimes that noise to truth ratio is not very good when people go onto social media.
Absolutely, we agree with that. And that's some of the work that we do. We try to vet the information. So anything that we, you know, send out through our social channels, we try to make sure that it's sound and research-based, and that it can help guide patients while they're in care, or to care, which in turn will make the physician or the caregiver's job a little easier. We're trying to help answer and empower patients to know that this is the right information and they're making the right decisions. And we're trying to work in concert to make your lives easier and to help grow these families. All right, we've got one last poll question. Has telemedicine improved your access to fertility care? Yes, no, or not applicable? This is a new question for our webinar series, and we're really excited to learn if telemedicine has given patients access or reduced or improved their ability to connect or to get access to a treatment quicker. Maybe they're making decisions to go to a clinic now because they can access telemedicine, where before they had to wait till their summer vacation when they could take several weeks off to do all kinds of sessions with a physician in a row, for example. And that'll come up in just a second. Wow, this is, wow, right down the middle. So a third of the population has said yes, a third has said no, and a third has said not applicable. So whether or not they've not needed that information. But I think, you know, access to initial appointments or follow-up appointments via telemedicine has really helped in some areas, because it means that patients aren't driving to a clinic 4 hours away or 7 hours away. They can get the information they need over the phone or via teleconference or video conference. So I hope that, I know it makes everything less personal sometimes, but that access sometimes is just as important for people who aren't able to, you know, downtown Montreal and downtown Toronto and downtown Vancouver are not easy cities to navigate at 7 or 7:30 in the morning when you have to get back somewhere else to work. So that extra pressure and the anxiety that can come with that is incredible, especially if you're now needing to get yourself there personally. If you're driving by yourself because you're the only one that's going to the appointment, because your spouse or partner can't be with you and you're not used to driving the city, there's a lot, it's really challenging. So I know we touched on this earlier. Are you both hopeful that telemedicine will have a place, an important place moving forward? Do you think that telemedicine will?
I don't think there's any doubt that it will. I think that the real question, at least in Quebec, the real question will be whether or not the government allows the clinics to do it. Because in Quebec, you know, in the past, you were not allowed, for example, to do certain consultations in certain ways and have the RAMQ cover it. So there have been these agreements, temporary agreements put in place because of COVID that have facilitated telemedicine. And amazingly, those agreements just keep getting renewed. Like every 3 or 4 weeks, we get an email saying, okay, it's renewed for another 3 weeks or another 4 weeks. But I think we all hope that the government will see the light and say, okay, this really should be something that's in place going forward, period. And COVID or no COVID.
Yeah, I would agree with Neil. I think they will, honestly, Neil. I think there are obvious benefits to this. How they plan to structure that, that's something that the civil servants will work out, I guess.
And, you know, I think when I think in general, the efficiencies that may come from some telemedicine. I mean, understanding that not every appointment with a physician, whether it's a fertility specialist or not, could happen via telemedicine for prescription renewals of certain drugs. Or I've certainly taken advantage with telemedicine when my young son had a very sore throat and I had to send texted pictures in, and I didn't have to go and sit with a very young child in a clinic, and I got the prescription, and it was amazing, an amazing experience. I also felt that it was very efficient. Do you feel that telemedicine could create some efficiencies within not only the medical community or the fertility community specifically, but within medicine, to take some of that burden off of physicians and staff, and even healthcare costs in general?
Yeah, I do.
I think undoubtedly it has already. Yeah, I think, and as you said, Carolyn, not just in relation to fertility care. I think in general care it has made a big difference. And the example that you gave is a perfect example of that. Actually, doesn't need to be somebody there looking after both of you to get you to see the physician, etc. So I think, yeah, I do think it's much more efficient, and that's why I think that I think it will stay in some form. We don't know what yet.
Of course, yeah. I hope that it creates some efficiencies for all areas of medicine, so that we can move forward in a really much, I keep saying efficient, but that's, for patients and physicians and care workers. You're all working really hard, even when it's not a pandemic. So that's really, really helpful. And also, just being out of a clinic without being around all these people, the reduction in disease or the transmission of, you're not sitting with someone who may have a stomach flu or have a bug, and that reduction in that will help fertility care in the long run. Well, everybody, we've come to the end of our session. I thank you so much for being here, Bill and Neil. This was an absolute pleasure. I have really enjoyed our time together. And I hope that we will be able to do this again in the near future. In closing, is there anything that either of you would like to say to the patients that are watching with us?
I think we all wish you well, and we hope that your treatments are going to be successful, and we applaud you for having the strength and the courage in the midst of a pandemic to keep the journey going and to follow your dreams.
And yeah, I would echo that, and also to thank you, Carolyn, and Fertility Matters. I think this is an important service too, to help patients through this journey, and particularly during this time.
Definitely. Thank you for that, and thank you both for being here. For all of you who are watching this webinar tonight, thank you for your time. Thank you for sitting. Thank you for submitting your questions. Incredibly thought-provoking questions, important information for all of us to hear and discuss, and to continue to discuss, because we know this will be continuing to change as the vaccine rolls out, and as the second wave or third wave, whatever is going to happen. So these conversations will continue. Fertility Matters will continue to bring you these webinars and this information. So please make sure you're connecting with us on our social media channels, on our website. Please subscribe to our newsletter. I want to send a huge thank you to EMD Serono, who has supported Fertility Matters in order for us to be able to bring you this incredible webinar. So thank you to them for their continued support of all Canadian patients who are struggling to build their family. And we'll meet you back for another session in the coming weeks and months. Thank you, everybody, for your time. Have a wonderful, safe holiday season and a really great new year.
Yeah,
Bye.